And the reason is very simple. 40 to 50% of questions in MCCQE1 focus on assessment and diagnosis. When I say focus on assessment and diagnosis, what I mean is that it focuses on what are the unique features in the case that will help you to make that particular diagnosis. Okay, 40 to 50%. So that means that 1 out of every 2 cases is going to focus on, okay, you see this, that, and that. What is your diagnosis? Or you see this, that, and that. What are possible diagnoses you need to think about? And someone may ask me, how did Dr. Bruni know this? Because I review the MCC materials very, very well. This part, this one. And why am I focusing on this? Look at something here. If you look at the dimensions of care, maybe you may not see that, but if you look at assessment and diagnosis, how the questions are distributed so far as physician activities are concerned. Okay, now it says that assessment and diagnosis, you're going to get about 45 plus or minus 5% of the cases focusing on assessment and diagnosis. 45 plus 5 or minus 5. So 45 minus 5 is 40. 45 plus 5 is 50. So that means you're going to get about 40 to 50% of your cases focusing on assessment and diagnosis only. And that is why I think that while you are studying, you must pay particular attention, because if 4 out of every 10 questions you meet, or 5 out of every 10 questions, or 1 out of every 2 questions you meet is going to ask you about assessment and diagnosis, then you must have a to break it down. Why are we focusing on assessment and diagnosis today? Because for me, it's very, very important. If you are not doing it the right way, it's meaningless. 40 to 50% of your cases, focusing on assessment and diagnosis, then it's good that you learn how to master it very, very well. Okay, 40 to 50% of the cases will focus on assessment and diagnosis. Number 2, 30 to 40% of the cases will focus on management. When it comes to communication, you're going to get just about 5 to 15% of the cases focusing on communication. And then when it comes to professional behaviors, that's what people talk about, ethics. Oh, Dr. Bruni, ethics. Everyone is afraid of ethics. You're going to get 5 to 15% of the cases. So the distribution of ethics and communication is similar, but the one with the highest distribution is assessment and diagnosis. And that is why we are starting with